Hello, it's 4 o'clock. This is an Ask Sky News Easing the Lockdown special as England prepares to loosen restrictions this weekend. Coming up in the next 60 minutes, 2 metres becomes 1 as social distancing rules are reduced. Pubs and restaurants prepare to open their doors as revellers get ready for Super Saturday. And a trim at last. Barbers and hairdressers get ready to tackle those lockdown locks for the first time in 3 months. Good afternoon. After more than 3 months of lockdown, some aspects of life in England will return to some semblance of normality tomorrow, but there is still some confusion about the new rules and why they are being brought in now. At 5 o'clock this evening, the Prime Minister, Boris Johnson, will attempt to explain all as he hosts a news briefing at Downing Street. Over the next hour, I'm going to be speaking to a panel of experts from the world of science, medicine and business to answer your questions. First, let's look at what is and isn't changing tomorrow. Our correspondent Adele Robinson has the details.
So from tomorrow, the 2 metre social distancing rule will be replaced with a 1 metre plus measure where 2 metres isn't possible. And in addition to that, there'll be recommended safety measures such as face coverings, increased hygiene and changes to business layouts. Social gatherings will also be different as 2 households will be able to meet regardless of size, indoors and outdoors. So things, for example, like dinner parties will be allowed and overnight stays as well. A long list of businesses will reopen, including restaurants, pubs and cafes, but safety measures will mean minimal staff and customer contact, table service and taking customers' contact details to help with any tracing in case of an outbreak. The tourism industry gets a welcome boost too as hotels, B&Bs, holiday homes and campsites open their doors with extra measures in place to keep shared facilities clean and safe. And there'll be plenty of cultural and leisure options available with the return of indoor venues such as museums, galleries, cinemas, amusement arcades and even fun fairs. Playgrounds, libraries and community centres have also got the green light, as have hairdressers, where staff will have to wear visors. Places of worship will also be able to reopen again for prayers and services, such as weddings, which will see a 30-person limit. So what remains closed? Well, quite a long list. Nightclubs, indoor gyms, nail bars, spas, bowling alleys, indoor swimming pools as well, and water parks will all have to wait a little bit longer before they're allowed to reopen.
Thanks, Adele. Well, in a moment, we'll get some answers to all your questions. Joining me, we have Oksana Pisik from the University of London School of Pharmacy. We've also got Patricia Yates from Visit Britain. We've got Charlotte Mensah from hair salon owner joining us also, and also Sean Tipton there at the end, joining us from ABTA to answer all your travel questions. But just before we get started, let's get a quick word from our Deputy Political Editor, Sam Coates, as we look ahead to Boris Johnson's news briefing in an hour's time. Sam, the Prime Minister said that today the UK is very much through the worst of the coronavirus pandemic, but warned people not to blow it. It seems that he's saying, yes, go out, but use your common sense and caution.
Yes, Boris Johnson wants to be the face of lifting the lockdown in England, at least for the area that he's responsible for when it comes to the regulations that change tomorrow. But he also wants to deliver a slightly more nuanced and cautious message, not least because there are, as the latest data shows, some areas where the R value is quite possibly above 1, and that includes London, which means that the coronavirus pandemic isn't shrinking necessarily in the capital. So the job of him today is to set out that whilst he is delighted clearly that restaurants and pubs and other social venues can reopen with the ending of the 2 metre rule, he's also going to stress that the success of these businesses and the livelihoods that rely on them do depend on everybody doing their part and continuing to observe those rules that remain and the guidance, which in many cases becomes voluntary rather than legal. So Boris Johnson wanting to be there as the country starts to come out of lockdown. Northern Ireland, of course, reopened its pubs today, Scotland next week, but also to deliver a cautious message to urge people not to get carried away with the freedoms that they'll get from midnight.
Sam? Thanks very much for that. Right, let's get started on your questions. Lots of you have been sending them in to hashtag Ask Sky News. Let's start with the most important thing for a lot of people. Charlotte Mensah, hair salon owner. How is it going to be different now for people coming in and getting their hair cut?
Oh, it's going to be very different because now clients can only come in one by one, like only at their appointment time. And there's no more waiting area. We have no magazines, no luxury of tea or coffee. And also, they all have to wear like gloves and masks. And all our team, we're all going to be wearing our masks and visors as well. So it's going to be very different. No chatting. It's going to be very, very different to what we're used to.
And the 1 metre plus rule, I mean, you're not going to be able to do that and cut someone's hair, are you? Is it just going to be a matter of that one person who's dealing with the customer will be able to touch them?
Yeah, so there's going to be, all our staff is going to be on rotation. So there's going to be just a few of us working at any one particular time. So it'll be much less work. We're going to open more longer hours and more days, because we're doing less work. So it's going to be very different. The fact that you can't even have that chat because you've got the mask on, is going to make it so different to what we're normally used to.
People are going to be so relieved, I think, me included. Let's move on to Patricia from Visit Britain. Patricia, what are going to be the big popular destinations tomorrow that haven't been open so far, do you think?
Well, I think pubs. I mean, I've booked in my local pub. It would be quite a different experience. So no walking in and just buying a drink. You need to have booked. You need to sit at a table. You need to order food. So I think a bit of pre-planning needed if you're thinking of going to places tomorrow. And of course, if the weather's nice, I'm sure people want to go to the beaches and go to beachside cafes and restaurants as well.
But one important question that quite a lot of people have wanted to know about is loos. Where will there be lavatories? Are they all now going to be reopening?
Do you know, I've heard it said that never have so many senior people been sitting around talking about toilets.
Very important.
So there is now there is now a website called Lockdown Loos that's been started up. That's sort of crowdsourced. So if you know it's open around your area, put it on there. But it's a really good place to start. Local authorities and destinations are looking at opening their toilets. We know so that some of the outdoor parks like Kew Gardens have pioneered opening toilets and managed to do it. And I absolutely appreciate a really important point for people.
Brilliant. It certainly is. Now, travelling a little bit further, Sean, let's bring you in from ABTA. Bill has tweeted, will there be testing for temperatures when you go to airports now?
It will depend on the country you're visiting. Certainly when you're leaving the UK, no, you won't. But in countries such as Spain, yes, you will. So it's a varied picture. It really is. I mean, the reason why travel is opening up at the moment is because the level of infection in many destinations has come down drastically. They've suffered quite a lot in terms of, as have us, obviously in the UK, in terms of the economic impact of this. And they want to open up, but they want to do it in a safe way. So you will have your temperature tested, as I said, in certain destinations. And if it is over a certain height, you might actually be quarantining at that point. But the countries have said if that has to happen, they will pay for that themselves. So it's a mixed picture, really. But I think the main point is this, that if you have a high temperature, then I think really think very seriously about whether you should be getting on that flight in the first place.
Another message in to us, an email. When will the fast-track passport services reopen? I guess the people who have got those luxuries might not necessarily want to stand with the hoi polloi with the rest of us.
Exactly. Yeah, to be fair, most people on fast track, it's because they've realised that very close to their date of travel that their passport needs renewing. Ooh, and they're going to lose their holiday. So it's not cheap, fast track. It costs a lot more money. But the reason why it's shut at the moment is that you physically have to attend an interview. Now, you can see, for obvious reasons, that's not something that they'll be very keen on doing. So I'm not quite sure when it's going to open up again. But applying for a passport, renewing a passport online is a very straightforward process. It doesn't take very long. It's taking a bit longer than normal, to be fair, but it doesn't take that long. And also, you can go into many post offices, and they run a service in conjunction with the passport office. There's a little fee for it, but they'll check to make sure that the application has been done properly. And at that point, it will be posted off by them to the passport office, and they pretty much rubber stamp those. So Generally speaking, as I said, don't leave it till the last minute. It's never a good idea because A, it costs a lot of money, and B, you sometimes have to worry about whether even that's going to come through in time. So, but usually it takes about 4 to 5 days for a passport to be actually processed. It's not going to be quite that quick now, but I'd say if you're coming up for renewal, don't leave it too late.
Don't hang about. Yeah, good advice. Oksana Pizik from University College. Andy has tweeted in. He says, you know, we were just talking to Charlotte there. Why is it safe for hair salons to open, but not tattoo parlours?
Sorry, what type of parlours?
Tattoo parlours.
So, of course, the nature of the activity involved and the type of contact is much closer than it would be even with hairdresser or in the salon because of the making the ink imprint in the skin and all of those more serious measures than what a haircut involves. So for that reason, it is safer for people to get haircuts.
Okay, and coming back to hair, Charlotte, is it better for you to wear a visor or a mask when you're going to be doing this? How difficult is it going to be doing your job now?
I think it's something that we're all going to have to learn to just deal with, because it's just a much lower risk of the infection spreading, and also, you know, when you're doing hair, you're so close and around the person as well. So it's good that you've got the visor and the mask on. So that way there's, you know, very, very little risk. And it's safer for the client as well as the stylist. So it's really important that we do wear the mask and the visors.
And of course, these things all cost. I know that I've managed to get a hair appointment booked in the next 2 weeks, 3 weeks actually. But I know it's gone up. They're saying that they're adding a PPE charge. Are you doing that as well? Are most salons doing that? Yeah,
we're adding an additional cost because we've had to buy so much, like disposable gowns, towels, that, you know, so much mask as well, and gloves for the customers just in case they didn't bring their own. And also we've had to put so much like partitions between the seats and the sink. So that also has cost a lot of money, so we're going to have to add that on. Hopefully it wouldn't cost too much for the customer, because they're so excited to be coming back and we want them to continue to come back, so hopefully it shouldn't be too much.
OK. Patricia Yates from Visit Britain. What about outdoor shows? We know that large gatherings of people inside are certainly not being encouraged or allowed, but what about some of the large outdoor, maybe agricultural shows? Are they likely to go ahead this autumn, this summer?
They're certainly not going ahead at the moment. And one of the big questions the industry has is that those big conferences, trade fairs, business events still don't have a start date. So I see there's a big increase in drive-in cinema, so you can do things like that. But no, there isn't a date for big gatherings to start yet.
And you talked a little earlier about being excited about going to the pub, you as a family. But what are the other, do you think, big family destinations that people will be wanting to go to? We've got pubs, we've got the beach. I mean, what about some of the big theme parks?
Yes, the big theme parks are opening. I mean, they've done a lot of planning on social distancing. The ones outside London are opening. So, you know, Alton Towers, Chessington, all looking to open. Again, you're going to have to book, and the food offering might be slightly different, and you might see people wearing masks, so slightly different experience. But I think this is something we're going to have to go and try, and it's going to be quite different. And then the museums are opening. Again, it's going to be time tickets, so you won't just be able to wheel into a museum when you feel like it. I think for all attractions, it's going to be time tickets, booking online. So we're going to have to be a bit more organised about our days out.
Well, and indeed, and I think we're all getting used to things being a bit different, aren't we? Andy tweeted me, Sean, he wanted to know, he's having problems getting a refund for a holiday that's been cancelled. I mean, this is a common tale, isn't it, that a lot of people have struggled to get refunds, and a lot of companies, especially small companies, just can't afford to give them.
Yeah, it's a real shame, and we've got a lot of sympathy at ABTA for people who've had to wait much longer than normal to get their money back. I mean, strictly speaking, the law says if it's a package holiday, if it's cancelled by the tour operator, regardless of why, they have to give the money back within 14 days. That's just totally impossible for the majority of them. With airlines, it's an even shorter deadline, 7 days. So the problem has been, for tour operators, it's simply being that they paid the money out already. They don't keep it. They pay it out to people like airlines and hotels, and they're having to get that money back. Some are in a very cash-rich position, so they can give it back themselves. Others are not. So that's why it's taking longer than normal. But I do know that situation has been improving as those refunds have started to come through. And also, I know the Civil Aviation Authority is looking into certain airlines who haven't been refunding quickly. And that would actually be really helpful, not just to members of the public who've booked directly with an airline, but also to tour operators who'd be waiting for that money to come back so they can give it back to customers. So it is an improving situation, but it's very unfortunate it's taken so long for some people. And I think it's also fair to say that some companies have done a much better job than others, but also others, they just weren't in a position to give the money back if they didn't have it because they paid it out already. But I think people have been generally very patient, but I think I fully understand how frustrating it is, particularly if you're in financial difficulties, having to wait so long to get that money back.
How many people do you think we're talking about, Sean? How many people have been trying to get refunds over the last few months?
Well,
it must be thousands.
Millions, seriously. If you look at the number of holidays it's millions. I think it's more than that, yes, because if basically when many people book well in advance in January and February for their summer holidays, it's when they get the best deals, etc. So it's in their interest to do so. So you can imagine, I think it's usually about a third of bookings are made in that period. So that's a lot of people whose holidays would have been cancelled. Now, many chose to rebook, but others simply said, no, I want my money back. So I don't think it's in the high millions, but there would have been a lot of people in that position. I'd say the majority just going on social media. That's where we get a good idea about how people are feeling about these things. And we've noticed recently a distinct dying down of people complaining about not getting their money back. So I'd say that does imply that the situation is improving, and also hits on our website, which gives advice on these kind of areas. Certainly anything related to refunds, the hits have started to go down. Now that I think that speaks for itself, that those refunds are coming through or have come through, but there still are people waiting. And again, I'd like to apologise to them. It's a terrible situation to be in, but everybody will eventually, if they wanted to have a refund, will get that money back.
Yeah, hopefully they've not gone quiet just because they've given up. Oksana, back to you. A message is coming to us on email from Jacqueline. She wants to know if the COVID tests, the ones that you can get if you think you may have symptoms, are reliable now. Are they reliable?
So testing is crucial, especially as we're reopening more and more. Currently, what we have found is that there's still about a 20% chance of a false negative. So that means that you've tested negative for the coronavirus, but you are actually a carrier. And of course, if you believe that you are not a carrier, you will behave in very different ways than if you get a positive result. So there is still some work to be done to ensure the accuracy of these tests, and also to then follow up with the contact tracing element to ensure that those who are positive do quarantine. That's how you break transmission chains.
Today, Oksana, it's been announced by the government that lots of new destinations we're going to be able to travel to, especially from England, different regulations for the other parts of the UK. One question to us, can the virus survive in seawater? If you go on holiday and do lots of swimming in the sea, will that protect you?
There is no evidence to show that this virus can survive in seawater, so I don't think that people need to be too concerned about that. However, while they're on the beach and when they are in water, the most important thing remains physical and social distancing, and trying not to, when you're speaking, try to move away from others. So more than worrying about seawater, which again, there is no evidence to show that, there are other really key behaviors. And as we've seen of many popular tourist destinations, many people are not abiding by the physical distancing rules.
OK, good advice. Oksana Pizik, you're going to stay with us for the next half, but it's time now to say goodbye and thank you to Patricia Yates from Visit Britain, to Charlotte Mensah, who is a hair salon owner and is going to be very busy tomorrow, and Sean Tipton from ABDA. Thank you all very much. You're watching a Sky News Easing the Lockdown special. More of your questions are going to be answered after the break. Stay with us. Hello, you're watching an Ask Sky News Easing the Lockdown special programme. I'm joined by a rolling panel of guests who are answering your questions on the lockdown changes which come into effect in England tomorrow. Well, still with us is Oksana Pizik from University College London School of Pharmacy. We're also, though, this quarter, joined by Maggie Appleton, who's the president of the Museums Association and also the chief executive of the RAF Museum. We've got Kate Nichols, who's the chief executive of Hospitality UK, and we've also got Kirsty Sadler from the restaurant chain Leon. So lots of excitement about a lot of things that you guys represent and are offering tomorrow. Kate, to you first of all, it does seem that a trip to the pub is what is exciting most people. Talk us through what a trip to the pub will be like tomorrow compared to how it used to be.
Well, I think you're going to see a lot less informality, a lot less spontaneity. There is going to be a greater degree of pre-booking. People are reserving tables, and it's clearly popular activity to do. So people are reserving tables not just for when they're eating, but also when they're having a drink in the pub in the afternoon and the evening. What you're going to see first and foremost is that it's fully seated inside. There'll be no standing at the bar and drinking at the bar, but hopefully you will still retain the atmosphere of a great British pub and have the full experience of great British hospitality with more at-table service, more online ordering where it's appropriate, but also more seating and more food.
And I suppose outdoor seating is going to be at a premium, isn't it? Are you more likely to be sitting outdoors these days than you ever would be? It might be a good idea to take your coat, knowing the good British summer.
Well, I think that is the limitation, isn't it, with our great British weather? But yes, an encouragement for people to be out of doors, an ability when you're at the pub to be able to meet 6 people from different households if you're out of doors. Indoors, it's just going to be members of 2 different households that will be coming together to eat and drink. So in the pub, if you're wanting to meet up with friends, it's going to be an outdoor activity. And obviously from the end of this month, we will see a greater increase in the areas outside pubs and bars and restaurants with deregulation of pavement licenses and service in gardens. So yes, it will be more of an outdoor activity. There'll be more space to be able to go and eat and drink outdoors and more opportunities to enjoy our hospitality.
And is it safe for you to take elderly relatives to the pub? Not that they'll be the ones escorting you home.
Well, obviously that is for people to make their own decisions about the level of risk that they feel comfortable making. We would recommend that for older customers that they want to make sure that they can be seated and that they therefore book in advance and reserve a table in advance. But clearly outside is less risky than indoors. And we'll have put in place all the measures that we need to do to make sure social distancing is maintained inside our premises and hygiene and sanitation standards are as high as they possibly can be. But clearly it is going to be a decision for customers to take about their level of risk. We can guarantee that when they come there, we'll be safe. It's for them to make that decision.
And Kirsty, just a bit more on the hospitality and on food. How are restaurant chains like Leon ensuring that food is prepared in a COVID-friendly way?
Yeah, I mean, I think, we're in the business always of dealing with food, which needs to have really high safety around it, a lot of hygiene. So obviously we've just taken that all a step further. So there's been much more effort into team training and reminders and alarms being set. We're now looking at hand washing every 15 minutes. We're in a slightly different situation as the nature of being a naturally fast food business, where actually more of what we look at is just fewer team members really coming into contact with any individual meal, which obviously helps reduce risk. It's slightly different on a restaurant sort of from scratch, fully from scratch system, but it is just trying to keep the focus of the team members, lots of checks in place, and also just trying to make sure that that is still happening when actually we've got a lot of reduced team members in a kitchen space. Kitchens that might normally have about 8 team members, were now, due to distancing, we're looking at having about 3.
Wow, so that's a real reduction in staff, isn't it? And will all of those staff be wearing face masks when they're in the kitchens?
Yes, we have a full supply of face masks and of gloves. So there's both their own protection when they're starting their shift, and then obviously all of those training and checks and balances in place. So not just about their own hand washing, it's about continuing to clean surfaces as well. So for example, outside of front of house, we have lots of things in place that are giving flexibility for customers to come in and order in a way they feel comfortable. So just for example, we have kiosks and then being wiped down again with a real frequency. So there's quite a lot of kit for the team, and just, yeah, it's a lot of it is about the procedures.
Let's bring Oksana, our resident expert, back in. Oksana, we've heard from pubs and restaurants, and they are all taking these precautions, but not all shops, not all supermarkets, not all of the staff in those places are wearing face coverings. Should they be, and does that make a difference to the spread?
Well, the WHO has made clear that face masks are not a silver bullet. It's one tool in a comprehensive public health package. So the distancing, in addition to face masks, can make a difference. Some supermarkets are actually offering face masks to individuals upon entry, not all, but some. And also more and more, we see people creating their own face coverings, particularly if they do have other types of issues that they underlying conditions, etc. So from the perspective of the face mask in itself, there's still the markers that are laid down on the floor to ensure that people are keeping their distance, that these cues are in order. Many places also have plexiglass type dividers as well. And not only face masks, we also see that visors are also being, face shields are being used. And even at UCL, we have colleagues who are 3D printing these for those that are in public facing roles, such as in shops or in pharmacies. So face masks are a good idea, and the WHO does recommend that if it is not possible to keep a 1 meter distance and physical distance from others, that it is recommended to wear them. But in itself, it is not a be-all solution.
Maggie, let's bring you in now. Talk about museums, the president of the Museums Association. How are museums going to be different? Is it going to be very similar to what we've just heard? Timed entrances, etc., etc.?
Very similar principles, yes. So timed entrances, and it's worth remembering that every museum's different localities, different shapes and sizes, but we're all working to the same principles, and those principles are all about the public feeling safe. And it's that combination of really helping the public to feel safe coming back to our wonderful museums, while still being able to give a really warm welcome. So at our own museum, at the Royal Air Force Museum, we have two sites, one in the West Midlands and one in North London. Yes, pre-booked entry, so we're asking everyone to book before they come. We're opening both our sites on Monday, and it's worth saying that some museums won't be opening for some time, partly because of their spaces, partly because they can't afford to. So we've all been going through a real tricky time, as I think the nation's aware, across cultural organisations. We open on Monday, pre-booked. We've got a great in-flight video to share with visitors what they'll expect when they come in and what they can hope to see. So we're having one-way systems. We can keep a 2 metre distance at our sites because we've got big hangars and beautiful outdoor spaces. And very much encouraging visitors to use that space. So we'll be keeping visitors apart, but I hope with a real warm welcome. Our staff are wearing visors so we can still give them a big smile when they come in.
How hard have the last few months been? You talked about some places not reopening. Obviously, some museums have got central funding. You know, a lot of museums are free, but smaller museums especially. How many do you think won't reopen?
Well, we hope the most will reopen. It will be a phased reopening, though, and when they can afford to. And again, it varies so much. So the museums that are really having a difficult time immediately, of course, are those that have charged for entry and have lost their income over the last 3 months. It's just disappeared. But of course, local authority museums, many of which are free, are also being concerned that it's really going to hit them over the next perhaps year, 2 years, 3 years. So every museum's affected, but in very different ways. And the RF Museum's the same. We've lost about £1.5 million from being closed for 3 months. So we are asking our visitors and supporters to keep on supporting and donating to us to do the incredible work that we do and that all museums across the UK are doing. It's part of our really important cultural landscape that's really important there to keep, the morale alive, but also helping us reflect on our current situation in the world. So museums are important, and we're all working really hard to be able to reopen our doors and welcome people back.
Kate Nichols, social distancing in a museum, as we've heard, in this instance, a big museum with open space is quite easy. Social distancing and alcohol, though, do you think they mix? And do you think pubs are going to become the pinch point? Are they going to have extra door staff, for example?
Well, obviously, hospitality is a broad and diverse industry, so it's not just about the pubs that are reopening. We have big spaces in our restaurants, our hotels, as many of our bars, where social distancing can be managed carefully. And we've put in place systems and processes and training to be able to ensure that our staff are able to make sure that people do socialise safely and responsibly. The principal mechanism we're using in pubs, everybody is going to be seated indoors. So those seats are fixed. We can make sure customers are keeping a respectable distance and that you're not having people standing up where social distancing might be a bit more fluid. And just as Kirsty said, our businesses are very well versed in managing risky situations and risky substances day in, day out. When they're cooking food, when they're serving alcohol, they are twice licensed, both the individual serving it and the premises that is hosting the social event. So they are licensed individuals, licensed premises, responsible and capable of managing the risks within their premises so that we can all keep ourselves safe. So people need to be aware that there'll be a warm welcome, but it'll be a safe and responsible one.
And we talked about the museums, about the possibility of people supporting them financially. They'll be hoping people will donate more. Pubs and restaurants have really financially suffered. Is there going to be, for example, minimum spends? Are prices going to be a lot higher when people do go in the next few weeks?
No, what we're doing first and foremost is trying to restore consumer confidence, to encourage our people to come back, our customers to come back and have a good time with us. We know we need to make sure that they feel comfortable to do that, confident to do that, and the spend will return. The government needs to work with us to make sure that customers do get that message, that they can enjoy summer safely and responsibly. But the industry has suffered massively. It's been the hardest hit industry of any sector when it comes to COVID. We've lost £73 billion worth of revenue. Many of our businesses have struggled to reopen this year altogether. And therefore we need continued government support as well as support from our customers. But we won't be looking to profit out of this. We'll be making sure that people have a warm welcome and are encouraged to come back.
You've been nodding away there at the end there, Kirsty, from Leon during that. So you're not going to put your prices up, but you do need to get bums on seats. You need to get people in and out as quickly as possible, don't you? Are you going to put time limits on the slots that people can dine in the restaurants?
Yeah, again, I mean, it's just so case by case. It depends on your business and what's going to be the most appealing way to get people back in, and also the safest way for you to manage it. For us at Leon, we are opening tomorrow and inviting people to be able to come and eat in. We've actually been lucky that, again, because we got flexibility, we've been able to actually stay open throughout the entire crisis, largely, of course, during the worst phase of it for click and collect and takeaway and delivery. In terms of eat in, we're obviously focusing on opening the sites that have got more space so that people feel more comfortable and can stay 2 metres apart. We're actually not going to put restrictions on it. We've just, on our signposting, we've asked people kind of consider themselves and the people that might be passing or waiting to come in. But I think also for quite a lot of people, this is just an opportunity to go and occupy a different space, somewhere other than their four walls. So, in a weekday where we maybe are quieter and there isn't such a demand for the seating. We don't want people to feel rushed. So it's going to be a balance. And obviously we're opening with about 5 restaurants tomorrow to allow and invite people back in. And we're going to see how that goes. And I think each restaurant and their team as well are going to be different. And we're going to just have to gauge what's necessary to keep the team happy and comfortable and to keep customers, like Kate said, feeling welcome. Because the team are incredibly excited to have more people coming back in. I mean, that's why a lot of them are in the hospitality industry. So it's something to look forward to for us.
And Maggie, just briefly to you, are you concerned about enforcing social distancing? Because people are coming for a day out to enjoy themselves. They don't want to be told off. Are you going to be physically enforcing it if people breach it?
I think museums, as we've been talking about with other colleagues, we're all about the warm welcome, and certainly museums that have opened internationally already and colleagues that have opened in parks and zoos so far are all saying that actually visitors are so pleased to be back. So we're not expecting to have to enforce it. We have got more of the team on to help with the social distancing, but it is all about supporting our visitors and welcoming them. So yeah, very much about the warm welcome.
Oksana, just a final one to you as well before we lose you. The one person's written in, Jill's written in to say, could reopening schools result in a second peak? That has been a concern over the last few days. Obviously, it's not going to happen until September. But are you concerned as an epidemiologist about that?
Certainly, I think we can all agree that we do need to ensure that children are getting their education and that we close the education gap that's widening. The government needs to be planning very closely with schools at this stage, use this summer period to create a variety of different plans so that to ensure that each school is safe. Because this is obviously going to be very difficult and could realistically shift that reproduction number above 1 quite quickly, as quickly as December. So the potential for that is very high. However, there has been many discussions around how to reduce contact, how to keep classes in bubbles so that they don't interact with other students outside of that particular classroom, and whether that goes ahead or not, we will see. But it is vital that in order for us to reopen our society and for kids to get back to school, that we improve the testing and tracing system so that we can quickly nip those outbreaks as they occur in schools, but in regions like we saw in Leicester.
Oksana Pizik, good to talk to you. Thanks for joining us and giving us your expertise today. Also, this quarter, Maggie Appleton, the one with the biggest smile from museums, Kate Nichols, Chief Executive Hospitality UK, and Kirsty Sadler from Leon. Thank you all very much for joining us to talk about how all of your organisations are going to cope. We're going to be talking health next and police. You're watching a Sky News Easing Lockdown special. More of your questions are coming up. We're also going to be hearing from the Prime Minister at 5 o'clock, so stay tuned for that. You're watching a Sky News Easing the Lockdown special programme. I'm joined by a rolling panel of guests who are answering your questions on the lockdown changes which come into effect in England from tomorrow. And joining me for this part, Dr Richard Vaultry, who's the chair of the British Medical Association's GP Committee, Henna Anwar, who's an NHS doctor, and Katie Bourne, the Association of Police and Crime Commissioners, joins us also. Thank you all very much. To you first, Dr Richard, how likely do you fear a second wave is as a result of everything opening up tomorrow?
I think there is a real prospect of a second wave, particularly if people are not social distancing. So it's imperative, as people do start to mix more with others, that they do keep their distance, that they do wash their hands well, that they wear face masks if they have to go closer to people than 2 meters or in confined spaces. It's imperative that we all do our best to avoid this virus from spiking back up again and causing a further lockdown.
Of course, not everything's opening tomorrow. Paul has emailed in. He wants to know, when do you think it'll be safe for councils to open daycare centres for adults with severe autism? And I suppose there are lots of other conditions that people will be keen to get help with that provide adult daycare. Any idea when you think it might be a sensible time for those to be reopening?
I think it's very difficult, and I think it's dependent on the checks and balances for each individual facility. We know that some people are much more vulnerable than others, but also that it's more complicated for certain establishments to open up and to ensure appropriate, safe social distancing in place. So it is something that we will be watching the government's guidance very carefully.
Another tweet this time, Wendy has been in touch. She says, should the elderly continue to self-isolate, even though the government said it is safe for them to go out?
I think it's important that we recognise there's a balance between social isolation, the benefit of reducing your risk from the virus, but also the problem of your mental health being impacted by prolonged absence from company of others. So taking sensible precautions for everybody is imperative. The government have issued advice for all people, regardless of age, around social distancing. That should be imperative at all times. But we do need to recognise that we all benefit from company of other people, and that can help us through these really difficult times.
Let's bring in Katie Bourne to talk about the police. I mean, a lot of people obviously celebrating that the pubs are open tomorrow, but I wonder how the police community is feeling about tomorrow. How are they feeling about enforcing the 1 metre plus rule, and how difficult it will be for them if people ignore it?
Well, first of all, we understand why people are very excited about tomorrow. Of course, we've put up with nearly 100 days of being in lockdown. And the police all along have been very clear that they are not there to police social distance. They won't be holding up tape measures to people to ensure that they're staying 2 metres or at least 1 metre apart. That's not their role. Their role has always been to support public health around this. So this is about engaging with people, explaining why we have social distancing, encouraging them to take responsibility, and then only using enforcement as a last resort. So police forces up and down the country are getting ready for tomorrow.
Will they be hoping that it will be pubs, restaurants, shops that will be encouraging people to follow the rules rather than them having to actually step in and actually enforce it?
I think that you're absolutely right. That is exactly what we are hoping people will do, that they will take responsibility themselves. We're in this collective endeavour together. This is not about the police coming in and telling people what they can and they can't do. At the end of the day, we all have a responsibility, and we make decisions about risk every day of our lives. We decide when we cross the road, we decide whether we fly in aeroplanes and so on. But this isn't just about the risk to ourselves. We must understand that we are still in the middle of a pandemic, and we don't have a cure, vaccine for this virus yet. So we have a responsibility to keep ourselves safe, but also think about others around us as well, which is why we have these guidelines in place.
How busy do you think it's going to be tomorrow? Are forces bringing in extra staff and people from holiday?
Forces are gearing up. They're ready for this. As you can expect, they've had plans in place for some time. Certainly in my own force area in Sussex, we have over 100 miles of coastline. We have the big city, Brighton and Hove, and we do expect people to come and to enjoy themselves. The pubs, the clubs are open. We're going back to some sort of normality. But of course, at the end of the day, you would expect the police to be ready and out there. But again, we are asking people to be really sensible about this. Social distancing is not a nice to have. It's there to protect all of us. It's there to save lives. And that's ultimately what we need to remember.
OK, let's bring in our A&E Dr. Henna Anwar. I imagine you're also gearing up for tomorrow. It's been really quiet in a lot of A&Es, hasn't it, over the last few months, aside from COVID. What are your feelings about tomorrow?
Yeah, so I don't work in A&E all the time. I'm a GP registrar that sometimes does shifts in A&E, and so I feel like I can't comment on how busy or quiet A&E department has been. But what I can say about the feelings about the hospitality sector opening up is it doesn't matter how me or any other healthcare professional actually feels about it. We know that it's happening, and we just want everything to happen safely. And that's all the rules and the guidelines that people have been talking about before me. And just like my colleague has said, to remember to do things like washing their hands regularly. And that's to protect you and to protect anybody else that's coming into contact with this virus. And we know the risk of transmission is also higher indoors. So as people start, visiting houses, just to be aware of that, and to be aware that the social distance guides are still there. And we do still need to self-isolate if we get symptoms. Those rules haven't changed. And we do still need to be really careful about visiting, as we start to be allowed to be visiting people's houses, that we're careful about who we're visiting. And if we have symptoms and somebody has been shielding, that they've got a higher risk of getting the virus, just to be careful about visiting them, and don't go if you've got any symptoms and things like that. So I think, I have spoken to my colleagues in A&E, and I wouldn't say that it's quiet. We've been busy. They've been split into separate areas, so they've been seeing the COVID patients in one area and then the other patients in the other area. It's been busy, and everybody's been doing the best job that they can do.
I know, Katie, from the police, that just seeing the police around, it's obviously not been simple for the police to social distance themselves, has it? They often work as a pair. Henna, how easy or hard is it for you to social distance in your job itself when there's somebody in a critical condition, or when you have to get close to a patient to see what's wrong with them?
Yeah, so we have to maintain the guidance that we've been given, and we know we have to wear personal protective equipment when we're seeing patients, and that's in the hospital and within the GP sector. So within the general practice, patients are seen in separate areas. So we have COVID sites, and then we have other sites that are not COVID sites. So we do have strict rules in place to ensure the safety of ourselves as well as the safety of the patients.
Let's bring in Dr. Richard Vautry again from the BMA, from BMA's GP committee. There's been real differences in social distancing, I've noticed, just walking around. Some people wearing masks, keeping their distance, other people, and I'm not going to generalise, but often young people, not doing it quite so much. Is that to do with, was it to do with spatial awareness? So it does seem that some people just don't really realise when they're getting close to other people. So that was one point, but the broader point was, if enough people do it properly, will it help everybody else?
Yes, I mean, there's increasing evidence that wearing masks protects those around you, and the more of us that do wear masks, we will reduce the spread of infection. Particularly if we're not able to maintain a greater than 2 metre distance between one another. So if you are in close proximity, by wearing a mask, you're protecting those around you. They will protect you by wearing a mask. And I think it is important that we start to recognise this is what's happening around the world, and increasingly we should be doing it here in the UK.
I've got a couple of final questions for you all. I'll come to you first, Henna. Do you feel attitudes have changed towards the NHS as a result of COVID-19?
Yes, so that's a very good question. So in my personal experience, I feel that people in the UK have always felt proud of the NHS. But certainly over the last few months, they may have been more vocal about the support that they've shown. I've always felt privileged to be part of this healthcare system here in the UK. And honestly, for me and my colleagues, I feel the support has actually helped us get through this really difficult time. But coming into this weekend, we know that it's the 72nd birthday of the NHS. And I just want to point out that as we come out of this lockdown, for me, this birthday feels different. This year, we'll remember all the people that we've lost, our patients and all our colleagues. And it's just to be mindful of that. And I've seen just how hard everybody's been working, and I'm sure that's with support from the public has actually helped that.
Good point, Henna. And Katie Bourne, I mean, I suppose in the same vein, you, like many people, will be presumably excited that new things are happening tomorrow. But are you also looking towards tomorrow with a bit of apprehension?
Well, I'd be lying if I said I wasn't, because obviously you want everything to work well, and you don't want to see areas becoming unsafe. But at the end of the day, you know, the majority of the public throughout lockdown have behaved brilliantly. We are talking about minorities. Yeah, and I was just reflecting actually on the question you said to Henna before. I think we're all incredibly grateful and proud of our NHS staff, but let's not forget all the emergency service workers and actually all those workers on the front line, you know, that we all took for granted before, but actually now we realise the value of the jobs that they do for us. So I think with that in mind tomorrow, let's bear that in mind when we're behaving responsibly. Let's go and raise a glass, let's have fun, by all means. You know, drink responsibly, be careful, and don't forget that the pandemic is still amongst us, the virus is still here. And until we have a vaccine, it's our duty to look after ourselves and those around us.
Well, that's a very sane point and it seems like a good one to end on. Katie Bourne from the Association of Police and Crime Commissioners, Henna Anwar, an NHS doctor, and Dr Richard Vautry from the BMA's GP Committee. Thank you all very, very much for joining us today.